So the next question is, when should I start and how often should I have a mammogram? Is it really that important? Well, here's what I'd like for you to consider. A cancerous breast cell divides about every 30 to 45 days. And that means that a tumor is microscopic and not detectable for quite some time by any means. Each time the cells divide, the tumor doubles in size. It takes about 30 divisions for a breast cancer to be felt. And so the fact is that most breast cancers are present for 2 to 5 years before they are detectable by touch. And more aggressive breast cancers will divide faster and become noticeable in less time. But there's still so much that we don't know about this disease. And I know that that sounds really scary, but it really underscores the importance of mammograms, which can detect breast cancer long before it's felt and at a time and a stage when it's much more manageable. So guidelines on starting imaging by mammography from the American College of Radiologists, the American Society of Breast Surgeons, and the American Cancer Society all start at age 40 with an option of yearly mammography until age 45, based on a discussion with your doctor about the risks and benefits of the study. And if there's an increased risk of breast cancer, for instance, history of radiation to the chest in childhood, or a first-degree family member with breast cancer in an early age, then we do recommend to start imaging earlier. However, all of the societies recommend yearly screening starting at age 45 and continuing as long as there is good life expectancy. Some specify as long as there is another 10 years of life expectancy. So that's a little non-committal and difficult to differentiate sometimes. But I think that it shows that as long as the person is healthy and able to get a mammogram, they should be getting a mammogram. And you may have heard about guidelines from the United States Preventive Services Task Force. They originally came out in 2010 and have been most recently reviewed and adjusted in 2016. These guidelines recommend biennial screening mammography for women aged 50 to 74. To be clear, these guidelines are quite a departure from the guidelines put together by the physicians who deal with breast cancer on a daily basis. I, and the great majority of breast surgeons, are in agreement with guidelines of yearly mammography starting at a minimum of age 45, and some women younger, and extending until other illnesses prevent screening. So to keep things in perspective, the two biggest risk factors for getting breast cancer are being a woman and getting older. So just because you hit 74 years of age does not mean that your breast cancer risk decreases. In fact, it continues to increase. And some women ask why we don't start mammograms at an even younger age. There are two main reasons for this. The first is that in women younger than 45, the breast tissue tends to be very dense. And I'll talk about breast density here in a moment. But mammograms are really not the best tool to view the tissues at that point. And the second reason is that the likelihood of a woman having breast cancer younger than age 40 is quite low without other evaluable risks. So the value and efficacy or benefit of screening mammography in younger women is quite low. That said, just so that we're all clear on this, about 15% of women diagnosed with breast cancer are diagnosed between ages of 40 and 49. So even though younger than 40 is not beneficial, the fact is that our screening guidelines have a value. And it's true that mammograms are not perfect, and yes, they can miss cancers. However, they are considered the standard of care, and they can pick up cancers before they are felt, or even at stage 0, so non-invasive disease, as fine microcalcifications. In fact, mammograms are the only imaging study that can identify microcalcifications. They cannot be identified on MRI, and it's very difficult to identify them on ultrasound. And there's no question that mammograms save lives. Since 1990, it's estimated that breast cancer deaths have been reduced by 40% in the United States with mammography imaging alone. And keep in mind that 75% or more of women have no obvious risk factors for breast cancer and no family history when they are diagnosed. It's also true that mammograms sometimes overcall lesions. And this is considered false positive and means that a biopsy may be done that comes back with no abnormality. But keep in mind that minimally invasive biopsies are rather straightforward and innocuous. And they really do give a wealth of information with minimal downtime. Mammograms should not be done in pregnancy. If a woman is pregnant and has a concern, other imaging can be done instead. And there is no contraindication to do a mammogram during breastfeeding, although during breastfeeding, the breast tissue is generally more dense.